Do you have sunken eyes or dark circles? Well, filler can really help with that. The reason why people get darkness under their eyes is because the skin there is very thin. So when you place filler in the skin, underneath the skin, you're getting the skin up farther away from the blood vessels that you can actually see that causes the bluish discoloration. So we are going to do tear trough filler right now. And it is very simple. I'm not even going to use a needle by her eye. I've already injected her on the sides of her cheeks, essentially, and I gave her some little lidocaine right there. And then I'm going to use a small pilot needle, and we're just going to make that little spot a little bit bigger. Can you feel that?
No.
Perfect. Okay, so we're going to make that spot a little bit bigger. Perfect. And now we're going to go in with what's called a cannula. And this is a blunt tip, so it decreases the risk of having bruising. You really cannot get into a blood vessel when you have a cannula because it pushes the blood vessels aside. It really depends too on the size of the cannula, because some cannulas are thinner and they can get into vessels, but the ones that we use do not. So now I'm going to go just travel underneath. You can kind of see where I'm at right now. I'm going to just travel right under. You okay?
Mm-hmm.
And I'm going to inject some of the filler right here. And I usually go really slow with tear troughs. So I'm going to apologize in advance. And you can see how just a little bit of volume in the right place can make a huge difference. Filler, as I said earlier, is made of high hyaluronic acid, which is something we have in our skin to begin with, but we also have an enzyme that breaks it down. So we need to replenish it. And for every decade of your life, you actually lose a whole teaspoon of collagen. And fillers, people are always nervous about fillers, but fillers are only really 1/5 of a teaspoon. Some of them are even less. So we're not putting in that much volume. And when you see people that have had fillers and you go, oh, I would never do filler because look at that lady. Well, they had bad filler. When you see somebody that just looks great, you may not even know, but they probably have had filler, or they may have. So don't discount filler just because of the bad filler you might have seen out on the street or on TV or whatnot. But you can see how, look at that looks great. It's a little puffy right now, but that looks really great. And I'm gonna come over a little lateral, and we're gonna put this direction. Is that okay? You feel okay? Okay.
Mm-hmm.
Our patient's got great cheeks naturally, so if people don't have very beautiful cheeks like our patient here, oftentimes in order to help the tear troughs, I'll start with doing some cheek filler. But I cannot improve on these cheeks. Gorgeous. So that's why we're doing some tear troughs here. And am I hurting you?
Mm-mm.
Good. I can't affect your vision by doing tear trough filler out here. The retinal nerve is behind the eye, and I'm not getting anywhere behind your eye. I'm just in the skin. But look at what a nice improvement that is already. That's great, if I don't say so myself. All right, so let's go to the other side, and we're gonna go similar. And I've only used 0.3 out of 1.0, so we have a bunch more filler to use. So a little bit of it goes a long way, especially in tear troughs. And also, how long will filler last in the tear troughs? Well, really, the filler companies say a year, but really it's one of those things where you don't move your tear troughs very much. Although you smile, you're not really moving under there. So it tends to last a little bit longer. That's why I always go very slow with tear troughs, because you don't want to overdo them, because tear troughs are also unforgiving. So you need to go to somebody that does a lot of them. I think you're my 4th one this week. I think we do a lot of tear troughs. Okay, so let's go into that was my little pilot hole, and pilot channel, I should say. And then I'm going to go right up under the skin here. Here we go. You're a great, steady patient, so you're hired.
Can you get Botox too? After this?
Oh yeah, you can do Botox. You can, I always say the only thing you can't do right after filler is do like laser treatments. You'd want to wait about a week. But yeah, you can definitely combine it with Botox. You can combine it with PDO threads to help lift the skin. Sometimes people will do PDO threads first. You know, you can, you can put PDO threads here and then you can come in a week later and just add a little bit of volume with filler. So combination treatments really are where it's at for this aesthetics world. It's like, I always say, it's like the gym. If you do one thing all the time, you're gonna get used to it and your body's gonna become more efficient. You're not gonna lose the weight or get in as good a shape. Same thing with your skin. If you always do the same thing all the time, your skin's not gonna react as it did before you did the first time. So sometimes do filler, sometimes do Botox, sometimes do Scarlet, sometimes do BBL Forever Young, sometimes do Halo. You know, if you shake it up, then your cells never know what is gonna happen to me today, and you'll get a much better response to everything. And then combination treatments are always good. I hope I'm making sense.
Mm-hmm.
Now I'm just talking, right? Okay, I'm getting out. You okay here?
Mm-hmm.
That's a little weird. All the way out here when you said tear troughs, but doing it laterally really makes a big difference because it helps lift out there. There we go, perfect. Tear trough filler is also very soft, so you don't want to push on it. It's like water on a dry sponge. If you push on it, you're going to push it right away. So don't do that. And it takes about 3 to 4 days for it to settle in. So even if it's just sitting on top of your skin, don't push on it. But that looks great. Good, beautiful. So we have a little swelling. I'm going to go mold that out in a minute, but you can see what a big difference filler made for you here. I love it. Again, remember that is important. I think I'm going to keep going over on this side, a little bit more over here, and then we'll come back to the other side. Let it settle for a sec here. It's nice to have this little pilot channel because if I was doing it with a needle, I'd have to go and poke you again. With this, I just go in the same spot. So it's simple. That looks really good. You'll notice when you look in the mirror that there's a little white area, and you can kind of see some whiteness around. Mm-hmm. It's because of the lidocaine that is in with the filler. All that discoloration is going to go back to normal in about an hour. So, yeah, that looks great. All right, I think we may be done. Yeah, you did good. All right.